Well, good evening, everyone. My name is Brittany Boyson, and I am with VETIGEL. And on the line, I have my colleague, Dr. Neil Smith, the veterinary director for VETIGEL as well. So the agenda, I will review about a 4-minute video or so, just some high-level application techniques. Then if there's any questions, we're happy to answer them. And then we'll go over some frequently asked questions that we also get. And then Dr. Neil Smith can also share questions and answers he's gotten and also his experience with the product. Okay, so you can see it being here used in that liver biopsy. It's a sterile 5 ml syringe. Fill that defect, slightly raise it. You're getting that overflow, that fanning out effect, and then shear anchor to the surrounding tissue. Now, sometimes you might have a misapplication. It could be a very heavy bleed. You'll see there was some pooling on that right-hand side. One call out is we're going to take wet gauze, like a saline soaked, to manipulate the product. Avoid using the back of a glove, the back of an instrument, a glove, or even dry gauze. Just another angle here again of that liver biopsy. Fill the defect and get that overflow effect. Here are those accessory tips, which are so critical for these hard to reach places like dental extractions. You can see it's actively pooling, and that is totally fine. You'll slowly start to pull back that syringe when you feel some resistance, and you really could flap, suture, and move on. However, if you had a fractured root or a reason to go back in, you absolutely could remove the product and even kind of do this aggressive flush, and you'll see that it doesn't cause a rebleed. So it's part of the technology of how VETIGEL works, and we'll get into that a little bit later. But again, it gives you that flexibility to go back in if you needed to do so. If not, totally fine to be left in for this procedure. So TPLOs, usually not your bloodiest procedures. However, access is your issue here. Very difficult to get to that area of the bleed. And that is the beauty of a hydrogel, is that it can flow and form to the different wound geometries. Now, again, still the veterinarian's job to get it to that area of the bleed. So the vet here is going to be a little creative and use a gauze as like a tamponade and push it into place. After a few moments, remove that gauze, making sure you have a nice application. And it really minimizes the bruising in something like this. Gallbladder removal. So think of caulking a tub. Apply pressure through that tip of the syringe, drag over that ooze. You wait a few moments, and again, able to finish out that procedure. And the next one here is a jugular vein in a 120-pound pig. So if you have suction in the hospital, really recommend using that. Just gives you some good visibility and you know exactly where that bleed is coming from. If not, I'd be using some gauze. Hold pressure. When you remove that gauze, quickly apply that syringe so you're getting right to that area of the bleed. This is a bald eagle blood feather. So one critique I have here is I don't love the glove application. You can see it still works. You're just going to have some room for error if you put your finger right in the middle of that fiber and patch as it's being formed. Wanted to highlight the accessory tips. So these are our precision accessory tips again. You can see how precise they are and able to get right to that bleed. You have great visibility through the whole procedure and very efficient and effective of stopping that bleed. Again, that one call out I have is that wet gauze would be ideal. But again, saving you a ton of time and able to move on to that next procedure much quicker. Epistaxis. So we want to make sure that the animal is sedated for this because we have to ensure that they don't sneeze it out the first few minutes of the procedure. Very difficult to do unless they are sedated. Food grade safe polymers. So there's no need for you to remove it right away. If the dog licks at some of it when they're waking up, totally safe. And then that wet gauze was a great technique to follow it up. Feline dental extraction. So every vet technician or vet nurse will make a joke and tell me that anything that's white or light bleeds extra because now they need to clean it up post-procedure. So this is where VETIGEL really delivers. We're saving time during a procedure, saving them a ton of time, offering better patient outcomes. But now we're also going to save time post-procedure. So again, you could just wipe away that excess and flap, suture, and move on. However, kind of showing off a little bit here, I wanted to really make the veterinarian feel comfortable how strong that fibering patch is and that you do not need to do this. But if you needed to go back in for a fractured root, you absolutely could do so, and the clot does not come with the product. And then the last one here is a mass removal. And it's really just to highlight that accessory tip once again. So it's allowing you to get really into these hard to reach places, into those nooks and crannies. The syringe without the accessory is a 5 ml. So sometimes could be a little bit too large if you have these tough places to get to. So I know that was a lot of information in a few minutes. Is there any immediate questions? Okay.
I think not so far. It is very well demonstrating the power of the coagulation.
Great. So I will show you some additional application techniques, and then Neil and I can kind of discuss some frequently asked questions that we get. So Neil, I didn't know if you wanted to share some of the feedback that you've gotten from peers and customers.
Yeah, absolutely. So this product is really great. It really works. I've used it in my own sight hand a couple of times, and I know other people who are using it an awful lot. The key is it's applied correctly, and it's very worth reading the instructions for use. And we've also got on the website some more sort of videos that go through using a model that shows you how to apply it. One of the key issues is you need to prime the syringe, but whether you're using the accessory or not, you need to doing it so you're trying to administer it downwards. So you're allowing gravity to assist, because the way it works when it comes into contact with tissue, it actually adheres to that tissue. So it's not a coagulant. It works purely by the mechanical action of creating a seal, which means it literally stops bleeding in seconds. And so, example, if you're doing multiple extractions, you can do the whole arcade. So extract, swab, gel, and if you want to suture, you can suture, particularly if you're doing something like cats, you can suture the whole arcade and not just individual teeth, which is why it saves time. So if you think about it, it's time saving, it's reducing blood loss, and actually it's better for the patient. But so after it creates that seal, you've got the fibrin patch that Brittany talked about, and and I'm not a chemist, so I call it magic. The bit about it is that fibrin patch doesn't adhere to or integrate with the gel, and this is what makes VETIGEL completely different from any other hemostatic product you may have used. You know, that the actual fundamental way they work hasn't changed in 2,000 years until VETIGEL came along, because they all work by being a matrix which helps the blood to clot, but they become part of the clot. You don't have a clear surgical field. If it gets dislodged, it starts bleeding again. So this is an actual paradigm shift in hemostatic products, but you have to apply it properly. And for example, if you've got a big tooth root or another void like that, the idea is you actually put the precision accessory in, and you go in the bottom, but you work round and you gradually extract it until you've got to the top, and then you anchor it off. You probably don't have, I don't know whether in Israel you have Mr. Softy ice cream, but it's very much how they fill up an ice cream cone, and you do that action. So you're actually getting the gel in contact with every part of the surface that is bleeding. So it adheres to it, and it stops that bleeding, which means, as Brittany said, you know, in most cases 3 minutes later you can remove it and there will be no bleeding. But it's that two-stage process. The first stage is the seal, which stops the bleeding, and then the fibrin patch forms. So think of it, so just because the bleeding stopped, it doesn't mean you can remove it straight away. You've got to allow that fibrin patch to form, but unless it's a high pressure bleed, that's going to have happened within 3 minutes. So yeah, I mean, it's the TPLO that Brittany talked about. The reason for using a TPLO is if you accidentally transect the popliteal artery, and then, as you saw in the video, you put in the gel, put a bit of gauze on top, and then again after 2-3 minutes remove it. I would suggest in TPLOs you do remove it afterwards, because of it's mechanically going to be there, and so when you suture up, it can cause some pressure, but you don't need to leave it in because the bleeding is going to have stopped. The other areas we recommend certainly considering removing afterwards are enucleations, because again, you don't want that buildup of pressure and fluid afterwards. And also if you're using it for spinal or brain surgery, which I know is a little bit specialist, but it makes a difference. You know, I've got some users in the UK who are using this 4, 5, 6 times a week as a hemostatic, and actually the smaller the patient, the bigger the benefit. There's also an enduring piece. If you have an opportunity, have a look through our Hemostasis Heroes blog, because in there, bearing in mind these things have all been individual interviews, people have not talked to each other, they've not seen the interviews. You come this concurrent this ongoing theme, which is it gives me confidence. VETIGEL's got your back. If something goes wrong, you know this is going to get you out of trouble. But I would say is consider using it routinely for large-scale dental extractions, particularly in that horrible small dog mouth where you need to do a lot of extractions. If you have FIV positive cats with gingival stomatitis, and also your sight hounds, so your greyhounds and their relatives who tend to bleed more, I still would use tranexamic acid in those, but I would use it because it saves you time, and also the animal isn't losing as much blood. And once you that initial cleanup post dental, you don't get that continual ooze that you get with more traditional ways of extraction. So actually the techs and the owners really like it because you haven't got that ongoing bleeding.
Great, thank you. Some questions that we also get are, what are the limitations of the product, or for species, age, things like that? So it can be used on companion animals, so primarily dog, cat. It's been used on pocket pets, exotics, equine. Where not to use it is on human and food consumption animals. So you can see this kitten is under a few pounds, under a few weeks old, totally safe to be done. So I wanted to make sure you felt comfortable with that. Another question we get is, where can't I use it? Where's the no way to use it? So the only time we're going to say, hey, let's not reach for VETIGEL is if it's going to touch a cornea. So it's great for enucleations where we know we're removing the eye in those procedures. However, if you may have a weird eyelid tumor and there is a chance that VETIGEL can rub up against the cornea, we're going to say, hey, let's not reach for it in that procedure. But to give you peace of mind, like Dr. Smith said, it could be used in the brain, the spine, all the way down to a toenail. So really from head to tail, just not if it's going to rub up against the cornea.
And the reason for that is because it's got these two polymers in it, and the chitosan-based one is actually quite gritty, and therefore theoretically it could actually cause a little bit of irritation. You don't want something grinding away in the corner. I know people who've used it, for example, on a third eyelid bleed, but they've rinsed it well off. Afterwards. But there's certainly no species that we're aware of you can't use it in. It's been used in a llama, and it's been used in an axolotl. So there's a sort of two fairly extreme cases. But yeah, as Brittany said, I mean, it's got definite indications. I'm sort of assuming that most people on the call are small animal veterinarians, but it has some specific uses in equine as well. So somebody's got a hand up. We've got a question. Yeah, do shout it out.
Yeah, if without intention it does touch the cornea while in surgery because of some error, what are the complications that you are washing it with saline or something?
Yeah, just rinse it off with saline.
And what can happen? It can cause irritation, inflammation. What will happen?
It's a physical characteristic. It's because it's slightly gritty. I mean, I've not seen anybody report this as an adverse event. This is just guidance that we give out. But just wash it, and as you've seen with the others, you can just flush it out of the way, and it'll be absolutely fine. There isn't a chemical reaction. This product is very inert. It's not exothermic. It doesn't cause any heat. It's been tested for biocompatibility against international standard. 10993 interpreted for veterinary use. That's a biocompatibility test for human medical devices, but that's been looked at. So there is no specific reaction that you're going to get. It's a physical thing. So we would say, if for some reason, I think it's difficult to understand the scenario where it would happen, but just flush it out.
Okay, thank you.
You're welcome.
Another question we frequently get is, what is the ratio? How much of the product should I use for the specific bleed I may have? Unfortunately, there's not a one-size-fits-all answer. The best way is to cover the bleed, whether it's more of a linear surface or filling that defect, the surrounding tissue, and then always anchor or shear it. We want to make sure we have a complete seal, never just abruptly lifting the syringe. So again, making sure we have a nice seal. I always say, think of like spreading either butter on toast, cream cheese on a bagel. We like a lot of food analogies here. And then again, if we need to touch the product, wet gauze, light even pressure. If we put too much pressure on the product, it can almost start to pancake it away and thin it out. And again, we're going to affect that seal. So this is my favorite video when it comes to true application technique. If you have suction in the hospital, really recommend using suction. Just helps you identify where that bleed is coming from. If you don't have suction, just using some gauze, light even gauze, and then quickly remove that gauze and apply that syringe. So you can see the doctor here is using suction, actively bleeding, getting that overflow. This is the shearing, so we're not abruptly lifting it. And then you can see without any manual pressure, the bleeding stopped. However, vets like to touch the product, and that's okay. Just making sure we use light, even pressure, and you can just kind of see how it really manipulated nicely over that tissue. This doctor removes VETIGEL in every procedure. He knows he doesn't need to, but that's his comfort level. So that's what he really likes about the product, is that you're able to remove it and you can just see this little bit that's left behind, and that's great. So that's all that you can be able to wipe it away. And again, that part where that clot doesn't get embedded with it, that's part of that technology. Any other questions for myself or for Dr. Smith? Oh, go ahead.
Yeah, about the restriction for use in humans, besides the regulatory aspect, is the physiology different if it touches without a glove a human or something? Is it just regulatory, or is there another reason?
Yeah, no, it's because it adheres to skin or to gloves, and therefore, if you get that adherence and you're going to break the seal and the bleeding's going to start again. It is, apart from the fact that you get this ionic cross-linking when it comes into contact with body fluids, it is effectively inert. So no, there is no. It's actually to make sure that it's working the way it should work, which is why you just only touch it with wet gauze.
I meant for use on humans.
Yeah, there's no. If it touches a human skin or anything like that, there's no. It's the regulatory aspect of the product.
It's regulatory, yeah. If we recommended or said people could use this in humans, then the FDA would get rather excited, particularly as the Crestalon also makes a product called Trauma Gel, which is for moderate to severe bleeding as a use of trauma in humans. And so we would be in real regulatory difficulties if we suggested VETIGEL could be used in man. So it's because that would put all sorts of alarm bells ringing. So there is, what we're saying is it would breach our sort of agreement situation with the FDA if we made any sort of suggestion of the fact that it could be used in humans.
So there is a similar product for humans? That's what they're saying?
The indication is different. It's for moderate to severe bleeding caused by trauma, and it's called Trauma Gel, and I don't think it's being marketed in Israel yet, but the intention is to market it all over the world. As I said, it got FDA 501(k) clearance last August. But for regulatory reasons, trauma gel is a separate product to VETIGEL. VETIGEL is for use for veterinary use. Trauma gel is for human use.
Okay, and the material, the name is different and the regulation is different, but the material has similarities or identical?
All we can say from a regulatory point of view that there are two separate products. One is indicated for veterinary use, the other is indicated for human use.
Okay, thank you.
Any other questions? We're happy to do this again if you guys think of something down the road as well. Please reach out to us. Really want to make sure you feel comfortable with the product. And like Dr. Smith said, we encourage you to use it on these lower level bleeds, gain your confidence and, getting familiar with your application technique. So when something does walk in the door, that's a very traumatic bleed, you feel very comfortable and confident to reach for VETIGEL. We're happy to do these down the road again. And if you want to go over very specific ones, whether you want to do ones for just dental or just biopsies, whatever that is, we're really here to support.
But don't save it for an emergency. And we've got another, Gal, another question?
Yeah, I'm the person who's the question, sorry. If there is any case that you saw complication with using the product, closure with stitches over too much product, some pressure, I don't know, any kind of complication that we should be aware of?
We get very few reports of complications, and when we look at these, some of these are absolutely, most of them, the vast majority of them are absolutely nothing to do with VETIGEL at all. And then the others generally are about technique, that people have not understood how it's used, how it's worked, they've applied it incorrectly. But the numbers are tiny. But as I said, when the information we get, there is nothing there that suggests that there are known complications. But we have adjusted the instructions for use last year, example. So we now put the piece in about the wet gauze because we had people sticking their fingers in it. We emphasise about the angle you use it and filling up from the bottom and making sure you cover everywhere that bleeds. We talk about the removals in the nucleations and a couple of other procedures and so forth. But no, there isn't. It doesn't have any sort of significant side effect profile at all.
Understood. Thank you very much.
You're welcome.
Well, if there's no other questions, happy to give you 5 minutes back in your day. And again, please reach out to either myself or Dr. Smith, and we're really here to make sure you feel comfortable with the application technique and whatever we can do to support.
Thank you very much.
Okay, thank you very much.
Thank you.
Thank
Have a
you
good
very
evening.
much.
Bye.